Hello visual learners, welcome back to the channel. Today we are reviewing a subject that students struggle with all the time, and that's antibiotics. This video will review the main classes of antibiotics, their mechanisms of action, coverage, and side effects. And the best part is I will be giving you some memory tips and tricks to help you retain the information. Stay tuned to the end to see how you can use these mnemonics to help you on exams and in clinical practice. There are 10 main antibiotic classes that you need to know. It is easier to learn antibiotics by classes since most of the antibiotic classes have the same suffix ending. I will also provide you with a visual anchor for each drug class to help you put an image to a name. This process will assist with memory retention since images are processed 60,000 times faster than text. The main antibiotic classes include glycopeptides, cephalosporins, carbapenems, penicillins, macrolides, aminoglycosides, lincosamides, tetracyclines, sulfonamides, and fluoroquinolones. Let's review them in their visual anchors one by one. Glycopeptides include antibiotics such as vancomycin, dalbavancin, telavancin, or ritonavir. Since these medications all have a part of the word van or vancin in them, use the visual anchor of a van for this class. Cephalosporins are a big class of antibiotics with many different generations. Check out our previous Color With Me video on how to memorize which cephalosporin belongs to which generation. The majority of the drugs in this class all start with the prefix ceph, including cephalexin, cefazolin, or cefoxitin. Use the visual anchor of a cephalopod for this class. Carbapenems include antibiotics such as meropenem, imipenem, and ertapenem. As you can see, the drugs in this class are super easy to recognize as they end in the suffix penem. Use the visual anchor of carbs or bread for antibiotics that belong to carbapenems. Penicillins are also a big class of antibiotics. The drugs in this class end in the suffix -cillin, including penicillin, amoxicillin, nafcillin, piperacillin. For antibiotics that belong to the class of penicillins, use the visual anchor of a penny or a silly penny. Macrolides include antibiotics such as azithromycin, erythromycin, and clarithromycin. These medications all end in the suffix thromycin. When thinking about antibiotics in the class of macrolides, use the visual anchor of macrolides. Aminoglycosides mostly end in the suffix mycin, except for amikacin. Examples of aminoglycosides include tobramycin, streptomycin, gentamicin, and neomycin. Use the visual anchor of the three amigos to remember the three most common aminoglycoside antibiotics, which can be remembered using the short mnemonic TAG. T is for tobramycin, A is for amikacin, and G is for gentamicin. Tetracyclines end in the suffix cyclin, such as doxycycline, tetracycline, and minocycline. Use the visual anchor of a Tetris piece when thinking about tetracycline antibiotics. There is a newer class of tetracyclines that include eravacycline and omadacycline. Lincosamides include the antibiotic clindamycin. The prefix clin can be associated with cleaning, or a cleaning broom that helps clean up bad infections. Sulfonamide antibiotics start with the prefix sulfa, including the most common one, Bactrim, which consists of sulfamethoxazole and trimethoprim. Use the visual anchor of a sulfa when learning about sulfonamide. Fluoroquinolones end in the suffix floxacin, such as levofloxacin, ciprofloxacin, and moxifloxacin. Use the visual anchor of florals or flowers when learning about fluoroquinolone. Now that we learned the 10 most common classes of antibiotics and which drugs belong to each class, let's review their mechanism of action by dividing the mechanism of action into three main ones: cell wall synthesis inhibitors, protein synthesis inhibitors, and miscellaneous mechanisms. Cell wall synthesis inhibitors include glycopeptides such as vancomycin as well as beta-lactam antibiotics such as cephalosporins, carbapenems, and penicillins. All beta-lactam antibiotics bind to penicillin-binding proteins to block cross-linking and final assembly of peptidoglycans, preventing the bacteria from constructing a cell wall, while glycopeptides such as vancomycin disrupt the assembly of the peptidoglycan precursor lipid 2. Overall, they inhibit bacterial cell wall synthesis by disrupting cell wall integrity and causing bacterial cell death. You can use the mnemonic vanquish cellular partitions to help you remember which ones are cell wall synthesis inhibitors. Vanquish stands for vancomycin, cellular stands for cephalosporins and carbapenems, and partition stands for penicillins. Protein synthesis inhibitors include aminoglycosides, tetracyclines, macrolides, and lincosamides. Protein synthesis is essential to nearly every biological process. including cell growth and proliferation. Protein synthesis inhibitors prevent proteins from being made by acting as inhibitors of translation or transcription, leading to bacterial cell death. Use the mnemonic MALT to help remember which antibiotics are protein synthesis inhibitors. You can imagine malt balls or protein balls. M stands for macrolides, A is for aminoglycosides, L is for lincosamides, and T is for tetracyclines. The rest of the classes have miscellaneous mechanisms. Sulfonamide antibiotics include sulfamethoxazole and trimethoprim. The brand name is Bactrim, a combination of two antibiotics that work synergistically to inhibit folic acid production. Folic acid is an essential component in the synthesis of bacterial DNA, and inhibition can lead to bacterial cell death. Sulfamethoxazole and trimethoprim are considered bacteriostatic when used alone and are bactericidal when used in combination. To remember this, use the memory tip folding sofa. If you can recall, the visual anchor for sulfonamides is a sofa. To remember the mechanism of action, envision a folding sofa. Folding is for folic acid and sofa is for sulfonamides. Or you can also think of the FO in sulfonamides as reminding you of its mechanism on folic acid. Fluoroquinolones work by inhibiting type 2 DNA topoisomerases and gyrases that are required for synthesis of bacterial mRNAs and DNA replication. Going back to our visual anchor for fluoroquinolones, which is florals, envision vines twisted together like DNA to help you remember that this class of antibiotics work to inhibit bacterial DNA synthesis. Moving on to antibiotic coverage. Since most antibiotic classes will cover both gram-positive and gram-negative bacteria, it is easier to memorize the outliers or exceptions. Vancomycin mainly has coverage for gram-positive bacteria, including MRSA. Imagine a super-positive van with the MRSA painted on the van. Cephalosporins are divided into 5 generations based on their spectrum of coverage. First-generation cephalosporins have better gram-positive coverage and poor gram-negative coverage. As the generation progresses, they acquire more gram-negative coverage. Special coverages to note include ceftaroline has MRSA coverage. Think of the taro in ceftaroline as helping with terrible MRSA infection. Cefepime and ceftazidime cover Pseudomonas. Imagine Pseudomonas lisa eating dime-sized pies for ceftazidime and cefepime or cefepime. Check out our previous Color With Me video for more info. Carbapenems such as meropenem and imipenem also cover Pseudomonas except for ertapenem. Think of the negative Pseudomonas lisa still at the bakery emotionally eating lots of carbs to remind you that carbapenems cover Pseudomonas. Additionally, think of the E in ertapenem as the exception to this rule, as it's the only carbapenem that does not cover Pseudomonas. Penicillins that cover Pseudomonas include piperacillin tazobactam. Think of the P in piperacillin as standing for the P in Pseudomonas. Aminoglycosides mainly cover gram-negatives, including Pseudomonas, a highly resistant gram-negative bacteria. Think of the NO or NO in aminoglycosides to remind you that it covers mostly gram-negative bacteria, including Pseudomonas lisa. Fluoroquinolones also cover Pseudomonas. Imagine Pseudomonas lisa being surrounded by flowers in her painting to help recall this information. For side effects, all antibiotics are known to cause diarrhea and upset stomach, which may subside with time. Some notable ones to memorize include vancomycin can cause nephrotoxicity and vancomycin infusion reactions. Carbapenems can lower seizure thresholds, especially imipenem. Macrolides can cause QTc prolongation, especially azithromycin and erythromycin. Aminoglycosides can cause nephrotoxicity and ototoxicity. Clindamycin is strongly associated with C. diff infections. Tetracyclines can cause teeth discoloration and should not be used in children or pregnant patients. Sulfonamides can cause Stevens-Johnson syndrome and thrombocytopenia. And finally, fluoroquinolones can cause tendon rupture and agitation in the elderly. Check out the following table for a quick summary of what we discussed and additional mnemonics. Now that we covered all the main classes, let's get into the miscellaneous antibiotics. Daptomycin works by inserting its lipophilic tail into bacterial membranes using calcium, causing depolarization, potassium leakage, and cell death by halting DNA, RNA, and protein synthesis. You can remember its side effect using the mnemonic Mr. A. The M stands for myopathy, R is for rhabdomyolysis, E is for eosinophilic pneumonia, and G is for GI upset. It covers gram-positives including MRSA, streptococci, enterococci, and VRE. Linezolid inhibits the 50S ribosomal subunit, preventing protein synthesis. It is well tolerated for short-term use, but has greater side effects with long-term use. Side effects you can expect with short-term use include diarrhea, nausea, headache, insomnia, and rash. Long-term use side effects include optic neuropathy, myelosuppression, and peripheral neuropathy. Be sure to be aware of other serotonergic agents while using linezolid. Linezolid covers gram-positive organisms including MRSA, streptococci, enterococci, and VRE. H3N is a monobactam antibiotic that interferes with cell wall synthesis by binding to and inactivating transpeptidase in gram-negative bacteria. You can use this mnemonic to remember its side effect by first recognizing that H3N sounds like a tree and the shovel digs into the dirt to plant the tree. DIG stands for D is for dizziness, I is for injection site reactions, G is for GI upset, and S is for skin rash. H3N only covers gram-negative bacteria and is important to be aware of significant rates of Pseudomonas resistance when using this antibiotic. Alright guys, that's it for now. If you found these mnemonics helpful, click the subscribe button for more. Let me know if you have questions in the comments and I will be happy to answer them. Thank you for watching and happy learning.